Republicans currently opposing the Senate's bill, is joining us now. Senator Rand Paul of Kentucky is with us. We'll keep an eye on what's happening with the president and his greeting with the India Prime Minister. Of course, Senator Paul, you are a member of the Committee on Health, Education, Labor, and Pensions. You've been thinking a lot about this issue. What does this bill need to get you to vote yes?
Well, you know, the fundamental flaw of Obamacare is that it says you can buy insurance after you get sick, but it also tells young, healthy people that your insurance is going to cost more because there's 12 regulations or mandates that every insurance policy has to have. When you mandate what insurance has to cover, you increase the price, you price out the young, healthy people, and the only people left in the insurance market get sicker and sicker. It's what they call adverse selection. It's also referred to as the death spiral of Obamacare. My problem with the Senate bill as it currently exists is we don't fix that. We keep 10 of 12 of the Obamacare regulations. We still keep the idea that you can buy it after you get sick. So I'm concerned that the death spiral of Obamacare may well even get worse with the Republican version. I'm also concerned that the Republican version keeps most of the subsidies and actually creates a brand new subsidy, $120 billion subsidy for insurance companies called a stabilization fund. All of those things together make me very concerned that we're not going to fix the problem here.
So you see this being too similar to Obamacare. What you see are problems. However, let me show you the latest numbers, the latest polling of the American people. Right now, 51% of those polled have a favorable view of Obamacare. That is the highest number the Kaiser Family Foundation has seen in polling, and above that 50% threshold since they began keeping track. 79 polls since 2010. Meantime, you can see the GOP healthcare plan is just 30%. Obamacare is popular right now, Senator.
Well, I would say the most important poll is if you say the individual market, if you're a plumber or you're a pest control guy and you're trying to buy insurance, in 50% of the country, there's only one insurer. We now have many counties where there's no insurers. So I think without question, Obamacare is a failure, and it's getting worse. Premiums have gone up 105% since we got Obamacare in the individual market. The individual market is in disarray. The insurance companies are pulling out, jacking up their premiums, monopoly in 50% of the country. So really the most important poll that you can point to is can you get insurance? And for 50% of the country, they're stuck with a monopoly, and it's spreading to where in many parts of the country, there's not going to be any insurance options. So something has to be done. Obamacare is failing in the individual market, but the best way to fix it is through freedom. And everybody seems to be afraid of freedom. What we should do is legalize inexpensive insurance. What does that mean? That means insurance without any regulations, insurance that you can buy what you want at the price you want to pay. Because right now, we have people with big hearts who say, oh, it should cover everything, but they price poor people out of the marketplace. So I know they're well-intended. President Obama wanted to help poor people, but he actually priced poor working-class people out of the marketplace.
So let me ask you this question then. If you roll back some of those regulations, perhaps it does end up making healthcare coverage cheaper for people who are younger, who are healthier. But what happens to those people who have pre-existing conditions, those people who are sicker, who are older, who may not be able to afford what insurance companies want to charge them for their treatments and health care?
The best way to help people with pre-existing conditions is to get them out of the individual market completely and let them get group insurance. And I'll give you an example. If you work for Toyota and your wife has multiple sclerosis, leukemia, breast cancer, or vice versa, the woman works and her husband has all these terrible problems, you don't have a problem. I mean, group insurance covers all of these things whether you get sick or not. The individual market is different. They treat you and your spouse as somehow an insurance pool by yourself, and it's not fair. So what I've been saying over and over again is let people in the individual market join a group. Let them join the Chamber of Commerce, the NFIB, AARP, Farm Bureau. Let them buy group insurance across state lines. Let them be part of a big co-op. Not that the government creates, but that we let the market create. And I think if you have confidence in capitalism, what would happen is virtually everyone would get coverage through a group plan then. There would be a few people who fall through the cracks, and I think that's what Medicaid's for.
Well, what would be the incentive for insurance companies to offer people with pre-existing conditions or people who have serious illnesses or who are older and will more likely need more hospital care?
It's market leverage. So, for example, General Motors might have 200,000 workers, and they have some of them who are sick or whose spouses are sick. Somebody sells them insurance because they want the 200,000 workers. So let's say the Farm Bureau in Kentucky has 30,000 people that buy insurance through them. What if they say tomorrow, we're no longer buying individual policies. We're going to go to one of the insurance companies and see if one of them will sell us and get all of our business, but we want a group policy. I think they have the market leverage to do this. Imagine AARP. AARP has 33 million people. If they chose to negotiate for health insurance, who wouldn't want their business? Insurance companies couldn't afford not to turn them down.
I hear where you're going. So President Trump gave you and a few others a phone call, we know, over the weekend. I'm curious, what did he ask you, and did you come to any sort of agreement?
You know, we had an extensive discussion about all the ramifications, which way the leadership's taking it, which way the conservatives want to take it, which way moderates want to take it. And what I told him that would get me on board, and we had, I think, a very frank discussion about this, I told him if we narrow the focus, let's just say we aren't going to fix everything. In fact, I don't think everything is fixable in healthcare. Let's say we're going to try to repeal as much as we can of Obamacare, and then we're going to work with the Democrats over the next 6 months to try to fix any remaining problems. I think once it's no longer a debate about repeal, but when it's a debate later on about how we fix healthcare, then maybe there could be some bipartisan coming together. But Obamacare is in such terrible straits, we should try to repeal as much as we can now of the taxes, the regulations, and see if we can do something to patch up Medicaid until we can get to a position where we can fix it. But
Senator,
the bill
with
would
all
have
due
to be
respect, you
narrower.
guys had 7 years to come up with the plan to replace Obamacare. Do you think there's going to be a vote this week, real fast, before I let you go?
Well, what we have is still some disagreement. We have conservative members who still want to repeal it, but we have some moderate members who want to keep it. And that's what we're going to have to figure out in the next couple of days.
Is it going to happen this week?
We'll see. I think it's a lot to digest in 1 week, not only to read the bill, but we don't even have the CBA score till this afternoon. So I think it would be very, very ambitious to think you could get it done. So far, the Senate leadership is not negotiating with our office. I'm trying to negotiate with the president, but really the president is going to have to tell leadership they're going to have to negotiate with some of us who don't see this bill as being good for the country.
Senator Rand Paul, we really appreciate your time. Thank you.
Thank you.